A question I commonly get in clinic is, doctor, what's the difference between having a Mako total knee or a Mako total hip compared to having a conventional one? The answer is simple. Faster recovery, less pain, less soft tissue trauma. On my hips and on my knees, I'm able to make smaller incisions. Smaller incision equals less tissue damage, and this equals less pain and earlier mobilization. With the total knees, patients are coming back in clinic at 2 weeks after a Mako total knee, sometimes with up to 120 degrees of flexion. People that have a traditional total knee without the robot usually come in with about 80 to 90 degrees of flexion. So if the recovery for one of these is about 6 to 8 weeks after a total knee, and you're already ahead of the curve at 2 weeks, you can imagine the next 4 weeks are going to be a little bit easier compared to the traditional way.